Hi, I'm Sean Welby and you're watching thefamilygp.com with Dr. Chris Steele. Hi Chris. Hi. Now, most women have heard of thrush, but did you know there's another vaginal infection that's twice as common as thrush? No, well, you're not alone. A recent survey showed that over 50% of women in the UK had never heard of bacterial vaginosis. And neither have I, to be honest. So, Chris, tell us a bit more about it. What is bacterial vaginosis?
Well, as the name implies, it's a bacterial infection of the vagina. In fact, it's the most common vaginal infection out there and will affect about 1 in 3 women at some point, in their life. And it is interesting that, over 50% of women not knowing what this is, yet it's so common. And of course, it produces symptoms that really, you can't ignore.
Right.
It's nothing like thrush. A lot of women, when interviewed in a recent survey, they were confusing thrush with bacterial vaginosis, thinking it was the same condition.
Absolutely. So what causes it?
Well, all over your body you've got bacteria, right? They just live in harmony with your body. And inside the vagina, where it's warm and moist and dark, the bacteria really thrive. And you have good and bad bacteria, friendly bacteria and bad ones. And the friendly ones keep the bad ones under control because of the sort of acid balance inside. Now, when that acid balance, it's known as pH, is altered, the friendly bacteria lose their sort of power and clout, the bad ones multiply, and they produce then the symptoms of bacterial vaginosis.
Right, so what symptoms do you look for then?
Well, you'll have a discharge, usually a thin, watery, grey to white discharge. Unfortunately, it smells unpleasant. It can be a sort of strong fishy smell or even a musty smell. The irritation from the discharge and the infection can affect the vagina and the outside, the vulva. And, many women are embarrassed by it.
And so who's prone to getting this type of vaginosis? Well,
if you've had unprotected sex, with several partners, you're at increased risk. If you have heavy periods, you're at increased risk. Sometimes using perfumed personal products can affect this acid balance down below. Really, that could be, a lot of women out there.
But it's important to say it's not a sexual transmitted disease, is it?
Very important, yeah. I'd like to stress that. Bacterial vaginosis is not a sexually transmitted infection. You don't catch it from somebody else. It's your bacteria have gone into an unbalanced situation.
Absolutely. So is it harmful?
Not really. I mean, you can have it there and not have many symptoms, in fact. But the bacteria can creep up from the vagina into the womb and along into your fallopian tubes. And then you can have pelvic inflammatory disease, which can be a cause of infertility. It can also be linked with premature labour and sometimes with late miscarriage.
Wow, so it's obviously quite an important thing to get sorted, really.
Yeah, very important. If you've got those symptoms, any of them, you need to be addressing them somehow.
Absolutely. So what treatments are available?
Well, I mean, the obvious thing would be to go and see your GP.
Yep.
He'll examine you, take a swab, send that to the hospital, and probably prescribe an antibiotic such as metronidazole, sometimes called Flagyl.
Okay.
And that's very effective. But some women don't like the metal taste you can get from this. And it can cause a little bit of nausea, so it doesn't suit every woman. But is effective, but the condition does tend to recur.
So is there an alternative to the antibiotics?
Yeah, I mean, you can treat yourself, self-medicate. Your best bet there is go to see a pharmacist, explain the symptoms, don't be embarrassed, okay? And there are products, creams and gels, pessaries that you can buy yourself over the counter.
Well, we've actually got an example here. It's called Balance Activ, and it's made exactly for the symptom we're on about.
Yes.
And it looks really easy to use. It looks,
Yeah, I mean, this contains lactic acid that, readjusts your pH levels in your vagina, the acid balance. And, I mean, this is a 1-day dose. There's 7 in the box, so you just twist, squeeze, dispose, and of course, this is obviously safe to use and safe to use in pregnancy. and no side effects.
Oh, that's fantastic.
Yeah, and you could also use this if you tend to get recurring bouts.
Yeah.
You know, maybe using just, you know, one tube every day for a couple of days, once a month, maybe especially towards the end of your period, that could stop the condition from recurring.
Absolutely. And what I think is great about this product is obviously it's still embarrassing ordering over the counter and asking for these kind of creams and gels, and so it's great that it's available on the website, isn't it, on the internet, www.balanceactiv.com, and you can go on there, can't you, and just order whatever you want.
Yes, and there's more information on that site,
Yeah.
you know, about the condition.
Absolutely. What would we do, without the internet?
Well, you know, very good for, you know, personal medical problems. You know, you haven't got that embarrassment factor.
So what should people do if they've tried all this and the symptoms are still persisting?
Well, if your symptoms are persisting, they've not got any better, you know, you've got to go and see your doctor. So any persistent discharge, any discharge that is tinged with blood, okay? Any any discharge at any time of your life, even after the menopause, and also with bleeding. If you bleed between periods, after intercourse, or after you've had your menopause, report that to your doctor as well.
Absolutely. Well, thank you very much, Chris. And remember, if you've got any doubt, just go and see your local GP or get more information off the Balance Activ website. I'd just like to say a big thank you to Inverness Medical for allowing this and other videos to be possible. Also, you can visit the Family GP for any other information. Cheers.
Thanks.